In this episode, we're exploring the crucial difference between burnout and compassion fatigue, because that numbness you're feeling with clients might not be what you think it is. Welcome to The Conscious Practitioner, the podcast helping massage therapists and wellness practitioners align with purpose, create deeper client transformation, and evolve your practice, even if you feel stuck. I'm your host, Dr. Jess, and each week we address your biggest practice challenges, from burnout to boundaries and everything in between. And together we uncover the inner blind spots behind these outer struggles that, when mastered, transform you from a skilled practitioner to a truly impactful one. In today's episode, you'll discover why feeling numb with clients isn't always about being overworked, the hidden connection between your past experience and current client interactions, and how to rebuild your capacity for genuine presence and connection. So with that, let's jump in. All right, so you know that moment when you're with a client and you suddenly realize that you're just going through the motions? I mean, I know you've been there. Most of us have, right? Your hands are doing the work, but your heart just isn't in it. Certainly not like it used to be. And if you're nodding to this right now, you are certainly not alone, because so many practitioners confide in me about this exact feeling, the sense of emotional numbness that can creep in, even when you're not physically exhausted. And here's what it often overlooks. You're technically doing everything right. Your schedule isn't even that full. It's as full as you want it to be. But somehow, when clients share their stories, their pain, their struggles, the usual things that they all do, you just can't seem to connect like you used to. It's like there's this invisible wall between you and your ability to really care. And here's what makes it even more confusing. Sometimes it happens with certain clients, but not with others. Sometimes it hits you out of nowhere, even after a restful weekend. And here's the worst part, the guilt. Because you're a healer, after all, a practitioner, right? You're supposed to be naturally compassionate all the time, or at least sometimes that's what it feels like we should be. So a question for you, when was the last time you felt disconnected with a client? And I really want you to think about it. Who was that client? What was the circumstances and situation surrounding that moment? You know what's fascinating about being a massage therapist? We work with people's bodies all day. But what really drains us, it's not always the physical work. I mean, yeah, it sometimes is the physical work. But my experience has been, is it tends to be more so the emotional labor. The holding of space, the absorption of energy, and the constant giving of ourselves. Now for me, I remember the moment that I understood the difference between burnout and compassion fatigue. Because it turns out there is a significant difference between the two. Now, compassion fatigue can lead into burnout. When you're burnt out, oftentimes you do have compassion fatigue, but let's kind of parse this apart a little bit. For myself, I was in the treatment room, I was about to start my day, and the room was as perfect as it could be. Everything was in its place, exactly where I needed to be. Fresh sheets, my supplies all lined up, exactly the way I wanted it to be. And as I stood there, something felt off. I'd just come back from a 4-day weekend, spent a lot of time outside, totally disconnected from my technology. I love those weekends. My schedule was totally manageable, and I've been doing all the right things. This was a period in my life when I was on top of it, right? Meditation, exercise, good sleep, healthy diet, all the things. But there was still this heaviness in my chest that wouldn't lift, and that heaviness occurred particularly when I thought about my work. Now, this particular morning, I had a client. We're going to call her Marie. And she was dealing with chronic pain from a car accident, nothing unusual. And as she lay on my table, sharing her struggles, her recovery process, all the things she was going through, I noticed something that really shocked me in that moment. I couldn't feel. What I mean isn't like physically, of course, my hands were doing all the right things and I knew what I was feeling with my hands, but emotionally, it was like there was a thick glass wall between us. And then she said something that really cracked things open. She mentioned how helpless she had been feeling, watching her body betray her, unable to do the simple things that she used to take for granted. And in that moment, I felt the surge of, well, nothing. Complete emotional numbness. And I'm curious, have you ever experienced this strange disconnect where you know you should be feeling something, but it's like your heart has gone offline? I mean, it's still pumping blood, but it's kind of emotionally gone offline. And here's what I realized in that treatment room. This wasn't about being tired. It was about being full. Full of my own unprocessed emotions, full of unprocessed grief, full of unacknowledged trauma, both my own and, very importantly, what I had absorbed from others. Because you see, as practitioners, we're taught all about muscles and fascia, we're taught about techniques and contraindications, but very rarely does anyone ever teach us about emotional resonance, about how working with somebody's body means we're working with their stories. We are working with their trauma, with their unspoken pain. And when we haven't processed our own stuff, that's when the numbness can set in. Because here's what's happening. Whenever somebody mentions something, either deliberately or subconsciously, it can affect you if you've got your own unprocessed things from the past. And that sucks. So your psyche, always being on your side, is going to do everything it can to make sure you don't feel that same suckiness. And it's just going to numb you out. Now, some of you might be thinking, you know what, Jess, listen, I've done my work, been there, done my therapy, I meditate, and that's awesome. Super happy for you. But here's what nobody's telling you. Our capacity for compassion, it's not static. It's not something that we fix once and for all. It's not something that is just there and always there. It's more like a garden. It needs constant tending, constant awareness. So that day with Marie, my numbness was trying to tell me something. It was showing me where I still had unprocessed grief about my own body's challenges, my own experiences with helplessness. The numbness wasn't the problem, it was the messenger. And this is what I call the resonance effect, when a client's story hits a little bit too close to home to our unhealed places. And in this case, we have two options. We can shut down, maybe we call it compassion fatigue, maybe we call it burnout, or we can wake up. We can move into conscious healing. When you think about clients who drain you most, what themes come up in their stories? What echoes do you hear from your own unfinished chapters? All right, so let's map this out. Imagine your capacity for compassion is like a musical instrument. When it is well tuned, you can play any note, meaning you can hold space for any client, and you could do so without losing your own harmony. But when certain strings are too tight or maybe too loose, that's when the music starts to get a little out of tune. Now, after that session with Marie, I started mapping my own reactions to different clients, and I noticed something fascinating. The clients who tended to drain me the most, they shared common themes, not their physical conditions, but their emotional landscape. There was Marie with her feelings of helplessness. Another patient of mine, we'll call her Sarah, was dealing with invisible chronic pain that nobody believed existed. It's all in their head, they kept telling her. Then there was another guy I was working with who was beyond frustrated that his body wouldn't fully cooperate with his healing process as he was recovering from an autoimmune condition, even though he was really doing his best. Now, each one resonated with different parts of my own unfinished story. And it might feel a little bit uncomfortable to acknowledge. Maybe it feels like admitting weakness to even consider how your personal history influences your work. But let me offer a different perspective. What if, and stay with me here, what if our stuff isn't a liability, but a doorway? What if those moments of resonance, when handled consciously, could deepen our capacity for genuine connection instead of depleting it? So here's how this resonant map can work. Number one is to notice sensations. Where do you feel numbness or disconnection in your body? Or where do you feel nothing in your body? Number two, track the story. What narrative or themes in the client's experience is triggering this response? Number three, find the echo. How does this resonate with your own unfinished healing? I'll go first. When Marie talked about feeling betrayed by her body, I felt a tightness in my throat and a little bit of an ache in my ankle. There is a sensation within my body that was subtle, but certainly there. A sensation that was definitely connected with her story of loss of function, and it echoed my own journey when recovering from an ankle injury. I told this story a number of times before, but I was climbing, rock climbing, and I took a fall. Now, when you're climbing, falling is not that unusual. You just have to know how to fall right. And even though I know all the rules, it just happened way too fast. And as I fell, I caught the toe of my right foot on a rock on my way down. It was about a 30-foot fall. And I utterly shattered my talus. I mean, it was so bad that the first surgeon who looked at the x-rays thought it was a sprained ankle because the pieces were so small. It wasn't until a couple days later when a second orthopedic surgeon reviewed all of the x-rays from the weekend, called me back and said, "We've got a problem." I went in, the orthopedic surgeon looked at me and said, "It's bad." I said, "How bad?" He said, "We need to talk about amputation." That's how bad it was. Now, of course, I said, "No, I don't want to do that. Give me some time to try and sort this out on my own." And I spent the next 3 years recovering from that ankle injury. Now, what's important to note is prior to that injury, my primary identity wasn't as a doctor of Chinese medicine. It wasn't as a practitioner, not as a business owner. My primary identity was athlete. That's what I loved. I loved triathlons. I loved running mountains. I loved hiking, of course, climbing and biking and swimming and all of these things that I couldn't do anymore. So it was an identity crisis. And even though I was giving my body everything it needed, it just didn't seem to be healing. I genuinely felt betrayed. And it felt like a disconnection from my identity. I was the one that others looked to for healing, right? I had the answers. I'd been through this process with a whole bunch of patients and clients in the past. And yet here I was spiraling. I felt shame. I felt helpless. I felt unable to heal myself. And there were some dark moments in there when I was wondering what the rest of my life would look like. Who would I be now if I had to get rid of this identity? Moments when I questioned whether I would ever actually feel like me again, if I'd ever be able to trust my own body again. Now, spoiler alert, everything's fine. I did indeed heal my ankle after a significant amount of time and effort, but I'm there. But I'm not the same person I was before my ankle injury. Now, when Marie spoke about her own body's betrayal, it wasn't just empathy that surfaced. It was every raw, unprocessed emotion that I'd buried during those years of struggle. That tightness in my throat, that little ache in my ankle, that was my body's way of saying, "You're still holding on to this." So this mapping process revealed something really quite profound. Compassion fatigue often shows up strongest when our wounds and our work intersect. So let's tie all of this together. Compassion fatigue and burnout are oftentimes used interchangeably, but they are not the same. As we've discussed at length in other episodes, particularly our 4-part series on burnout, burnout is multifactorial, and it's often a result of misalignment, lack of purpose, and chronic workplace stress. And this can manifest as exhaustion, cynicism, lack of efficiency, the typical symptoms. Compassion fatigue, on the other hand, is more specific to those in caregiving roles, and it arises from the emotional toll of empathizing with others who are suffering. While burnout leaves you feeling disconnected from work, compassion fatigue can make you feel disconnected from your clients and your own sense of compassion. So here's one actionable thing you can do. It's that resonance check-in. During a session, when you notice a moment of emotional numbness or maybe disconnection, pause internally, take a deep breath, and ask yourself, What is this lack of feeling trying to tell me? And instead of pushing through it or ignoring it, treating it as a signal, it might be pointing to unprocessed emotions or maybe some unresolved personal experiences being triggered by the client's story or even their energy. Acknowledge this response without judgment. And in the moment, you might not have time to fully unpack it. In fact, you probably won't have time to fully unpack it, particularly if you take the task seriously. Make a mental note to revisit it later and do so through journaling or reflection, or if you've got a great counselor, chat with them too. This practice isn't about fixing the numbness on the spot. It's about honoring it as a messenger. Now, over time, addressing these messages can expand your ability to hold compassionate space for clients while also facilitating your own healing journey. Each moment of resonance is an opportunity for growth, connection, and transformation, both for you and your clients. This is not about preventing these feelings from unconsciously influencing your client interactions. It's about using them as a tool for growth. Because when you notice these messages and you take time to process them through journaling and reflection and therapy, you expand your capacity to hold space for your clients and, very importantly, their own healing journeys. And in doing so, you tend to heal yourself. Each resonance check is an opportunity to deepen your connection to your work and your own inner transformation. And with that, thanks for spending your time with me today. Before you go, I want to highlight 3 key insights from our conversation. Number 1 is compassion fatigue isn't a sign of weakness or you're doing anything wrong. It's an invitation to deeper your own understanding of yourself. Number 2 is your triggers are treasures in disguise. They show you where your next level of growth is waiting. And third, sustainable practice isn't about avoiding these triggers, it's about having the tools to transform them. So thank you so much for joining me on today's journey into understanding compassion fatigue and the powerful role of resonance in our work. And if this episode resonated with you, don't forget to follow or subscribe to The Conscious Practitioner wherever you get your podcasts. It would mean the world to me if you did. Together, we'll continue to explore the intersection of inner work and professional growth, building the tools to create a more sustainable, aligned practice. Until next time, be well, my friend.